how this works is we're testing your ocular muscles and your cranial nerves. Let's take one eye, for example. When we move, in this case, my right eye, and yours is your left. When I move the pen towards this way, I am testing my lateral rectus muscle, and that is cranial nerve number 6, abducens. When I move it upwards and out, that's the superior rectus, cranial nerve number 3, oculomotor nerve. When I move it out and down, inferior rectus muscle, which is also by the oculomotor nerve. When we move the pen medially towards our nose, that is the medial rectus, oculomotor nerve, upwards and inward, inferior oblique, and that is also oculomotor, cranial nerve number 3. And when we move our eyes in towards our nose and down, superior oblique, innervated by cranial nerve number 4, trochlear nerve. Hi, and welcome to our ASMR eye clinic. My name is Nurse Hiraya, and I understand that today you are coming in for blurred vision. Is that correct? Okay. I'm so sorry to hear that you're having this blurred vision lately. Before we begin, I'm going to explain to you what we're going to do today. So, first, may I have your name and your date of birth? Okay. Alright, I'm just going to pull up your chart. I see. Okay, I see you. There you are. So, before we begin, would you be able to tell me where you are right now? And would you be able to tell me what day it is today? Okay, good. Perfect. Alright, so I'm just going to chart that. Person is oriented to place, time, and person. Good. So we can now begin. So first, there's 2 parts of this exam. One part involves me asking you some questions, some detailed questions, so that I could understand better what your concern is. And the second part is going to involve me having a look at your eyes, looking from the outside, making sure that you're able to see and that your eye muscles and your eye nerves are working. While I'm doing this procedure, I'm going to be explaining to you why I'm doing certain things, so that way you also have a better understanding of your own eyes and your own health. That way you can know how to take care of yourself. How does that sound? Good? Okay. The second part of the exam is going to involve me just looking at your eyes, having you read a few things, a few letters from a little card called the Snellen chart. And then we're also going to examine your eye movements, as well as taking a look at the back of your eyes to see how your eyes are doing. Is that okay with you? Good. Perfect. Okay, let's begin. So, could you tell me a little bit about what happened? When did this blurred vision started? Okay. While you're explaining to me what happened, I'm also going to make some notes in my chart. which eyes are affected? Is it the right eye, the left eye, or both? Both. Okay. So sometimes on your prescription you may see something that says OD, OS. OD means oculus dextrous. That means it's the right eye. Dexter means right, dextrous. The left eye is sometimes referred to as oculus sinestris. Back then, it was thought that the left was evil, so sinestris means bad, so that would be the left eye. So oculus dextrous, the right eye, and oculus sinestris, the left eye. Now, do you know what those means? Perfect. Okay, so on my chart, I'll put both eyes. OU. Started having blurred vision. I'm so sorry to hear that. How long has it going for? Okay, a few days. When did it begin? Okay, I see. So it sounds like there's a lot of things at work that's causing you some stress, even affecting your vision. Has there been anything else that's happening during this time that is associated with the symptoms that you're having, such as headaches? Okay, headaches. Inability to sleep. That too. Okay. Oh, and even you're having kind of tremors is what we're saying. Okay, tremors in the left eye. Is it the upper eyelid, the lower eyelid? The lower eyelid. So the lower eyelid is starting to have some tremors. Okay. I'm so sorry to hear that. Has there been any pain? No? Okay, good. That's good to hear. And have you been seeing anything that are like floating around? We call them floaters, or even halos. None of those. Anywhere where your vision is starting to get more pinpointed and narrow. We sometimes see this in a condition called macular degeneration. Nothing. And there hasn't been any pain. I think I asked that. No. Okay. Sometimes we see that in certain acute cases of glaucoma, which we don't want. Perfect. Okay, good. So, are you taking any medications? Sometimes medications can cause blurred vision. Okay. Alcohol or drugs? No. Okay. Sounds good. Alright, let me just make sure that it didn't miss anything here. Pulling up your chart again. I see. Any double vision? Any dizziness? No. That's good. That's good. Sometimes, often, dizziness can accompany the blurred vision, but in this case, it's just a headache. Okay. Any redness or swelling? I don't really see it just looking at you, so that's a good thing. And your tear ducts, are you able to cry? Okay, last time you cut an onion, yeah, that could be really uncomfortable. Any excessive watering or discharge of any sort? No. Okay. Okay. Do you use contact lenses at all or glasses? Okay. Okay. And when was the last time you visited an eye doctor? Quite a while back. Okay, quite a while back. I see that it says on your chart. I see. It's been a while. So, welcome back. Thank you so much for answering those questions. I know that coming in to have your eyes checked can be a really scary and sometimes even stressful thing to do. I myself had my eyes checked lately, and that was quite a stressful time for me. So I could understand how that could sometimes be stressful. So before we continue, I'm going to take your blood pressure. But before we do that, I'm just gonna ask us to take a slow, easy, deep breath in. And exhale together through the mouth. In it, okay. So, it looks like you had a recent blood pressure reading here. Okay, and everything looks normal. 118/24, that's pretty good. Sometimes need to be careful with the blood pressure because high blood pressure can damage our eye vessels, such as in glaucoma. Have you had your blood sugar checked recently? No? And do you have diabetes? Okay. A history of diabetes? Okay, on the mother's side. And do you have a family history or anyone in your family, your parents or grandparents or anyone in your family having eye concerns? Okay. I ask that because over time, people with diabetes, their nerves tend to get damaged by the high amount of sugar in their blood vessels. A sugar molecule is crystalline in shape. It's kind of like this hexagon shape. And when the blood travels through the little vessels and those hexagon sugar-like molecules travel along the blood, and if there's too many of them, you can imagine that those molecules are rather large. That's why we don't normally pass those in our urine. They get filtered. But in people who have diabetes, those sugar molecules are so abundant because there's not enough insulin to capture them and bring them into the cells. They stay in the bloodstream, and what happens is that those sharp, jagged edges can begin to nick the tiny blood vessels, thus causing problems with sensations, especially in the feet, and it can cause damage to the vessels of the eye, which is what we're going to look at later. Also damages the blood vessels of the kidney, and sometimes there could be so much the kidney gets overwhelmed, and then people with diabetes start to urinate glucose, sugar in their urine, and that's why sometimes their urine can even smell sweet. Back then, that is how physicians diagnosed diabetes. They actually used to smell the urine and also taste it, because back then we didn't have a glucometer. It's a machine that checks our blood glucose. That's a fun fact. Another fun fact is that insulin, which is the drug we now use, it actually acts like a hormone, insulin. It's secreted by our pancreas, it's an organ just behind our liver, here in our upper epigastric or upper abdominal area. It's a long, it's always drawn as yellow in the pictures. It secretes insulin, and insulin is responsible for capturing the glucose and bringing it from the bloodstream into our cells so that our cells can have energy. Now, insulin used to be derived from animals like pig, and that's what we used to give to humans. It was discovered here in Toronto, where I live, in Canada, when they were trying to find a cure for diabetes for dogs. Isn't that quite interesting? And now they're able to synthesize it in the lab synthetically and administer different types of insulin. Some of them act throughout the day. Those are long acting. Some of them are very short, rapid acting, and some of them are medium. So depending on what type of insulin a person is getting, they may have to poke themselves with a needle to inject it 3 times a day, each and every time they have a meal. So that's why it's very important to prevent diabetes from happening in the first place by making sure that we, number one, don't eat too much sugar. We don't consume too much, because if we consume too much, our body is going to start getting desensitized to the sugar. It means that our body will start getting used to this new level, and then sometimes our pancreas may not secrete enough insulin to capture all the glucose, because our blood sugar keeps spiking up. So it's important to not indulge too much on sweets. Of course, every now and then it's good to have them, but it's important not to do it every day. Okay, the second thing that helps with preventing diabetes is getting enough exercise, because exercise burns off the sugar, burns off the calories that we consume. And lastly, it's important to have sleep, because that regulates our circadian system, which tells our bodies when to secrete certain hormones. So as I said, insulin being a hormone, when our body senses that there's too much sugar, it secretes it. Sometimes when we're stressed, it also secretes certain hormones like cortisol, which can then confuse the body to release more sugar into the blood. Okay, so that's it, a little lecture on eye health. But let's begin. So today we're going to take a look at our eyes. Okay, this is the anatomy of the eye. Here is just showing some components of the external eye. Okay, here are the muscles of the eye. This is what rotates the eyes. There are 6 of them, okay, in each eye, and we'll go over that in the exam. And in order for those muscles to work, there are nerves that connect to the muscles, and those are shown here, the yellow ones being the nerves, and we'll go over those. Those are part of the 12 cranial nerves, so we'll do those in our exam. And lastly, we're going to take a look behind your eye with an ophthalmoscope, which looks like this. This is an ophthalmoscope. We're going to look behind the eye to see the only layer, there's 2 layers that are visible to us in this exam. The outer layer, the cornea, okay, the sclera, and then the inner layer, the retina. The middle layer, the choroid, we're unable to see, which is our physical exam. Okay, so how does that sound? Do you feel a little better about this exam? Yeah, it helps when you know what's happening. Right. Okay. So let's begin. First, what we're doing. Perfect. Okay. So the first thing that we're going to do is we're going to get our Snellen eye chart. This is so new, it hasn't even been opened yet. Okay. Oh goodness, this is quite nice. There's 2 of them. Okay. So this one, here's a Snellen eye chart, and this is what determines our visual acuity. It means how well do we see in a given distance. So over here, where it says 20/20, means that at 20 feet or 6.1 meters, a person can see clearly from that distance. Okay? The larger the denominator, the bottom number, and the lower the numerator, the top number, suggests like nearsightedness, or this person needs to come closer. So someone like me is nearsighted because I can see fine close up, but in a far distance, I can't. Someone who is the opposite, can see far but needs reading glasses to see up close, is someone who is farsighted. Okay, so this should be held about 36 centimeters from the eye. So we're going to take our handy dandy ruler, measure 36. Okay, that's about 36 right there. Okay, so I'm just going to put this here, 36 meters away from you. Okay, perfect. Okay. So 36 meters away from you is a chart. Okay. Are you able to, with both eyes, okay, read the top, okay, the second line, the third line, as far as you can go? Okay, everything is just fine there? Okay. Now I'm going to have you cover one eye, okay? Cover your left eye and see, are you able, how far can you go? Okay, can you read this line? And more down? Okay, good. And then we're going to cover the right eye, okay? And see how far you can read. All the way up to here. Perfect. So, if you have spectacles, glasses, you can remove them now, and we're going to see if we're able to read. Second, Snellen. Okay, it's a little bit more difficult to read numbers. In my eye exam, cause I have quite a poor vision, when they asked me, what do you see? And I said, is that a number? And they said they were all letters. So it was quite challenging for me to be able to visualize what's in front of me, because my eyesight, I've been wearing glasses since I was in grade 8. Okay. Alright. Now can you tell the direction of these letters? Okay, it's an E, that's right. This one's facing right side up. Okay. And that one's facing up. And this one's facing backwards. Okay, perfect. Perfect. Okay, good. Is there any pain or discomfort while reading the Snellen chart? Okay, that's good. So I'm just going to record, as I said, OD is 2020. That's the right eye. That's the right eye. And OS, the left eye, also 2020. Okay. So now we're going to do the confrontation test. Okay. So this exam is going to involve me to use my fingers and to see your peripheral vision. Okay. Okay, so before we begin the exam, I'm going to just use a sanitizer to perform hand hygiene. On some gloves. Good. So going to perform the confrontational exam, which is going to enable me to see if your peripheral vision is working. So how that's going to work is we're going to cover one eye, okay, the opposite eye. So I'm going to cover my left eye and you cover your right eye, and then I'm going to have my fingers, I'm going to wiggle it, and when the moment you see it in your vision, without moving your head, just keep your eyes on my nose, then that's when you tell me now, okay? Over here, now. Mm-hmm. Okay, I'm going to do the same thing on the opposite, okay? You're going to cover your left, I'm going to cover my right. On the top. Now. Okay. Now. Now. Okay. Alright. Now, what this does is it tests your ability to see, which is governed by the optic nerve, cranial nerve number 2. In people with macular degeneration, they might start seeing a vignette, dark, they start losing vision in the periphery, and it becomes more tunnel vision. So that's why we're doing this test. Okay, so we're going to repeat the test just this time with both eyes. Just focus on my nose area and tell me how many numbers you see, okay? Alright. Mm-hmm. Perfect. Okay, good. The next exam that we're going to do, the H test. Okay, so I have my pen over here, and you're going to keep your gaze on this pen while holding your head steady, okay? Alright, so let's begin. So I'm just going to move it closer. Alright. Alright. And then 4. We're testing for your accommodation. Does the pupils constrict? And out this way. Okay. As far as you can see. Okay. 4 down. This way. As far as you can see, so you can hold it. Good. I know this can be uncomfortable, but I'm testing to see the strength of your eye muscles. Sometimes when the muscles are weak, we can see a little bit of nystagmus. That is, your eyes start moving in a rhythmic pattern. And down. Okay. Alright, so how this works is we're testing both your ocular muscles and your cranial nerves that are responsible for moving those muscles. Let's take one eye, for example. When we move, in this case, my right eye, and yours is your left, when I move the pen towards this way, I am testing my lateral rectus muscle that moves the eyes upwards, and that is the cranial nerve abducens. Cranial nerve number 6, abducens, because it abducts, okay? When I move it upwards and out, okay? Upwards and out, that's the superior rectus, cranial nerve number 3, which is the oculomotor nerve. When I move it out and down, okay, that is the inferior rectus muscle, which is governed also by the oculomotor nerve, cranial nerve number 3. When we move the pen medially towards our nose, that is the medial rectus, also oculomotor nerve, cranial nerve number 3, and we move it upwards and inwards, that is the inferior oblique. The inferior oblique pushes the eye upwards, and that is also the oculomotor, cranial nerve number 3. And when we move our eyes in towards our nose and down, that is the superior oblique, the superior oblique, and that is innervated by the cranial nerve number 4, trochlear nerve. Okay, good. So I'm just gonna take your eye covering here, okay, and we're gonna repeat the eyes, the same test in one eye first. So first I'm just gonna cover one eye, okay, and then we're gonna follow the same thing. So upwards, okay, back in, this way, and in, and I'm gonna move the pen close. People should constrict and accommodate, converge. Perfect. We're gonna do the same thing on the other eye. Good. And side, keeping your gaze just on my nose area. And down. Moving forward. And out. Perfect. Alright, I'm just gonna quickly cover and uncover. Okay. Cover and uncover. And here I'm testing to see if your eyes deviate to one side or the other, which would suggest a lazy eye is what it's commonly called. Okay, good. So now, okay, I'm just going to note the general appearance. I'm going to now place my hands onto you, starting with pulling the eyelids down. If you could look up. Okay. I'm noting the sclera, its color, okay, it's white, so that there's no jaundice. Okay, I'm gonna pull the lids up. If you could look down. also looking at the vessels and looking at the eyelids as well to see if there's any pallor, which we sometimes see in anemia. I'm looking at the eyebrows. You've got beautiful eyebrows. Sometimes we see thinning of the eyebrows, not only because of overplucking, but because of hypothyroidism. See thinning of hair. Okay. We're looking at the pupil size. Okay. The pupil size. The pupil is a dark center in our eye. Okay. Normally, on this chart here, it'll be anywhere from 3 to 5 millimeters right there. So you can even compare that to my eye. Okay. When we're stressed, okay, our pupil dilates. It gets wider so we can see more. When we're relaxed, then it constricts. Before we take a look into the back of the eyes, we're going to put an eye drop, okay? An eye drop because we are studying naturopathy, we are using natural substances, although some substances can be dangerous, especially this one if ingested. This is belladonna. It's part of the deadly nightshade family. Bella in Italian meaning beautiful, donna, lady. Belladonna used to be used by women in the prostitution industry to dilate their eyes to make them look more attractive, and that's why it's become known as belladonna. Ingested, it can be really toxic. It's part of the deadly nightshades family, which is the same family as tomatoes and eggplant, which is why the berry of belladonna almost looks like a little round eggplant. Its color is, very shiny. The skin is very shiny and it's almost like dark, almost purple-like. So belladonna, it dilates the eyes. How does it do that? Because belladonna contains a substance called atropine. So before our modern synthetic medicines that we now use to dilate the eyes, atropine was responsible for many uses, including dilating the eyes, because it's an anticholinergic. Okay, an anticholinergic agent is something that stimulates the sympathetic response. Sympathetic is the flight or fight. So remember I said when we get stressed, our eyes become wider and bigger so that we can see what's around us, to see if there's danger. Okay, so same thing. When we use belladonna, which has atropine, it will dilate the eye so that we can see. Now, when your eyes are dilated, it may be uncomfortable looking at bright things. That's a common side effect, or in this case, a desired effect, so that we can take a look behind the eyes, the retina. Okay, so I hope you learned something new about the history of medicine, but that's what do. Okay, so before we put the eye drops, we took a look at the pupil sizes, as I said. Normal pupil size is anywhere from 3 to 5. So in this other chart, you can see anywhere from 3 to 5. But when we get stressed, it gets bigger. When we're in a relaxed state, it gets smaller. There are times when the pupil sizes may be unequal. Okay, this happens in about 5% of people. This is called anoscoria. Okay, where it's normal in that case for those 5%. But in some cases, it could be due to an overdose, a drug overdose. Okay, heroin drug overdose can tend to do that. Or a nerve impingement, particularly Horner syndrome. Okay, so when we're looking for the eyelids, we're looking for ptosis. lid leg or lid drooping, okay, because that's one of the symptoms. The 3 triad of Horner syndrome: lid lag, anoscoria, as well as anhidrosis. Anhidrosis meaning inability to sweat. Okay, so with atropine, however, ingesting atropine, it can cause sweating because we are stimulating that sympathetic nerve response. Funny enough, going back to belladonna, this is also used homeopathically by homeopaths and naturopaths for treating the similar symptoms that are presented when you ingest the belladonna berry or the belladonna plant, such as the anticholinergic symptoms, redness in the face. Belladonna tend to be right-sided redness, increased fever, very, very high fever, restlessness, and this individual can sometimes be very, very angry, like rage-like. And that's when we would use belladonna homeopathically in a mental state in order to calm and soothe the person down. I know this could be a lot of information, but it's just fun to know. Okay, so we examined your eyes. Okay, the iris is a beautiful color. You've got a very beautiful color of eyes. That's the colored part that we could see. This part of the exam involves me testing the response to an external stimuli. Okay, so I'm just going to lift the pupil, the eyelid up, the upper eyelid. Okay, and I'm going to just tap it with this cotton ball. Okay, good. And what we see is a blink reaction. Okay, so remember the cranial nerves that we are testing. So the cranial nerve number 2, optic nerve, will enables us to see the cotton ball coming closer and closer. And if we touch the eyelid, the sclera, the white part of the eye with it, then we get a kind of a blink reaction by the trigeminal nerve, particularly the first V1 portion of the trigeminal nerve, which is the ophthalmic branch. So that tells us that your cranial nerves involving the eyes: number 2, optic nerve; number 3, oculomotor, responsible for dilating and constricting the eye and even moving it in many directions; cranial nerve number 4, trochlear nerve, the inward towards the nose movement; cranial nerve number 5, the trigeminal nerve, at least the ophthalmic branch, V1 version, the V1 portion; and the cranial nerve number 6, abducens, which abducts, takes the eye outwards in the lateral rectus muscle, are all intact. It's a lot to know, but you can always rewind the video. Okay, let's take a look at what else we need to do. Okay, good. Okay, I'm just going to palpate around the inner canthus, that's the inner part of the eye, just to see the patency of your lacrimal ducts or your tear ducts. Sometimes when this gets occluded, it can get really uncomfortable, not allowing us to cry and just hold up all those tears literally bottled up inside. Okay, so that seems soft. Okay, is it tender at all? No? Okay, good. The eyelashes are also beautifully intact. You've got very beautiful eyelashes, so that's wonderful. Okay, so the external eye, okay, seems everything seems good, although I do notice some dark circles. That tends to happen when we're a little stressed out and we haven't had a good night's sleep, as you have mentioned to me. So just take care to hydrate. Make sure you're drinking enough water. That will help reduce the puffiness in the eyes. Okay, and also getting an adequate amount of rest is going to help reduce the puffiness of the eyes. Okay, all right, sounds good.